Go. Come in.
Good morning. My name is Darby Lipka. I'm going to be your student nurse today. I'm going to be performing a physical assessment on the infant, if that's all right with you.
Yes.
Okay. So I'm going to do my hand hygiene real quick. I'm going to come over. While I'm doing this, I'm doing a general assessment of the area. I'm seeing the interaction between the mom and the baby. Usually, if we were in a clinic setting, I would have the infant either on the mother's lap, if that was more comfortable for her and the infant, or we'd be in a crib, but for the setting, we're going to have it on bed. I'm going to start off by verifying on the wristband the child's name, date of birth, and allergies. So, what is his name?
John Thomas.
And his date of birth?
August 20th, 2020.
And does he have any allergies?
None known.
Okay. So, then we would begin this assessment, and to start off with, I'm doing a general, just look at the infant to see if his color is correct, there's no sign of cyanosis anywhere. If there's any bruising, if he's fussy, he should be very content, eating, sleeping, because he's only 1 month old at this point. So I'm looking, I see nothing that's abnormal. So I begin the physical assessment with the head. Actually, I begin by measuring him. We would have him lay out on the table or on his mother, and we would measure him straight. And then we would do the head circumference to make sure that he's within normal ranges for his development. And then we would begin with the head. Looking at the scalp, he may have hair, he may have not. We're just seeing if anything's abnormal with the hair distribution. I'm making sure that the scalp is the correct shape. We could have a little bit of molding since he's just a month old, so there could be a little bit of that present, but for this instance, there's none. I'm going to be looking at the fontanelles as well. So I'm looking at the anterior one, which should be closing between 9 and 18 months. I'm looking at the posterior one, which should be closing between 1 and 2 months. I'm making sure that they're not sunken or that they're not bulging, because that would be a problem. And besides that, I'm also looking for any lung sponge lesions or any abnormal signs that the infant's been dropped or that he's having some physical trauma. From there, I move on into the ears. I'm looking to make sure that they're symmetrical, that they're not low set, that there's no abnormalities, no discharge. I'm gonna be checking inside the ear, making sure that there is the tympanic membrane's intact and that there's no swelling, there's no bleeding, there's no lesions or anything that would be abnormal, and there's none. So, and at 1 month, we could ask maybe the mother to say something. If he's awake, he might be looking over at him or at her. And but I mean, at this point, they could be still too young to actually perform a hearing test on. And the same thing goes with the rest of the cranial nerves. The infant could be too young to even have them tested, so we will try our best to test for sight and everything else that would come along with the cranial nerves. So we move on to the eyes at this point. We're looking for symmetrical eyes. We're looking for any signs of jaundice within this baby. We're looking for the conjunctiva, making sure it's pink and moist, that the sclera is white, that there's no damage to any of the retina or anything like that. At this point, we've got an ophthalmoscope. We would perform the red light test, which would be shining in each eye, and it should come back that it's good for both, which we do. I would also check pupil size while I'm here, making sure it's correct pupil size. I would also try to elicit a test where we could have him maybe follow an object if he can, whether it be a rattle or a pen light, if he could do it. We'd have that. That'd be normal for this infant. So as we're looking move on, we're gonna go to the nose. I'm looking at the nose. This infant should be a mouth breather. A nasal breather still at this point. So looking, making sure, and put our finger under the nose, making sure it's still breathing. On the other side of the nose too, making sure that both sides are patent. We're gonna look into the nose, make sure the mucosa is pink and moist, and that there is no lumps, bumps, lesions, discharge, bleeding coming out of the nose. There's not a deviated septum. To normal, which comes back normal. This infant has no problems. So from there, we're gonna move on to the mouth. And the mouth, I'm looking for any signs of the lips being cyanotic, which would be a big problem. So we're making sure that he has enough oxygen. While we're at the mouth, we're gonna also be doing the two reflex. We're gonna be testing for two reflexes while we're down there. Well, one will be the rooting, which is gonna be when I brush the infant's face, he should turn to that side and look for food, which would be elicited like this. If we brushed aside and he didn't turn, that would be abnormal. We'd also be doing the sucking reflex test. So obviously my hands are gloved. I would put my finger towards the infant's mouth and he would start sucking. And while we're doing this, we'd also be checking the palate to make sure that there's no cleft palate or there's no signs of, any teeth eruptions. And he would elicit that reflex and he would be sucking. So that would be normal. If he wasn't sucking, it would be abnormal. So from here, we'd go into, we would try to get the infant to open his mouth as best as possible. And then we would check inside the mouth, making sure that the mucosa is pink and moist, so there's no signs of bone sponge lesions, that there's no swollen lymph nodes, the trachea is going to be midline, and those would come back normal. From there, we move on to the neck. I'm looking at the neck, I'm looking for, like I said, any bruising of the neck, any abnormal skin folds. I mean, there should be a lot on the baby because he still has a lot of this fat. We're looking for webbing, and then we're going to test reflexes, or not reflexes, but we're going to test to see the movement of his muscles. They should be able to turn their head. Some infants favor one side, so we're trying to make sure that they're able to move their head both sides. And if they were to favor one side, we have to set up a physical therapy appointment for that infant so we can get them to work both sides. Okay, so from here, from the neck, we move on to the chest, stomach area. So we will be auscultating for lung or heart sounds first. So I'll be using the belt, the stethoscope. Actually, before I do that, I'm going to be assessing the area, making sure that there's just nothing abnormal, that the chest is, there's no injuries, it's not sunken in, it's normal, nipples are in line, there's no extra nipple, which everything is normal in this infant right now. So I would auscultate now. We're going to use the belt, the stethoscope, because he's a small child. And then I would start off with the left upper sternal border, which is going to be the second intercostal space down. We go there. And then the right upper sternal border right here, second intercostal space. And then we'd go the lower left sternal border right there. And then the apex of the heart over here. And we'd hold that for 1 minute. And these are on the fourth intercostal space. And that's where we're going to be listening for a minute. And then it comes back. Could be signs of a slight murmur. That'd be normal for this infant. If anything is and we're looking for any adventitious lung sound, or not lung sounds, any adventitious heart sounds. So that came back normal. Master Mom, have you had any issues with him having like a fast heart rate?
No.
Anything? Okay, so you'd be comfortable with what he is doing. So from here, we're going to go on to the heart sounds. He's been breathing okay, right?
Yes.
No problems? Okay. So, because the infant has such a big heart and such a small body area, it's going to be hard to auscultate on the front and the back. So what we would do is take the belt, the stethoscope, and go on the sides and listen for his breathing there. So, we have him breathe. And then we'd have him breathe. Okay. And while I'm listening to his lung sounds, I'm also watching the respiratory rate so I can perform and see if they are where they're supposed to be and whether they're in range. So there was no adventitious lung sounds, no wheezing, no crackles, nothing noted. So his breathing is okay. And now I'm looking at the stomach. So we're looking, stomach is not distended. There could be a slight distension, but we're just looking in that area, checking out the umbilical cord area. We're looking just to make sure that's healing okay, making sure that there's no discharge, no bleeding coming out of it, and that it's, it's on track for the recovery that we expected. So from here, I'm just gonna palpate around the stomach, making sure there's no enlargement of any organs that need to be looked at. Everything's okay. So now we're gonna go in and we're gonna also take for bowel sounds. So back in here, all right, lower, right upper, left upper, and left lower. Okay. And I already asked the mother about his feeding and how they were going, and she said that they were breastfeeding and that everything was okay. So I would have nothing to worry about here. Bowel sounds were normal. Okay. So from here we move on to the extremities. But before I move on to the extremities, I would elicit one more test while we're down here. It's the Moro test, which is going to be like the startle test. So having him lay on something that's going to be soft and comfortable for him, we would basically try to just elicit a drop, but obviously being protected of him. And a normal Moro reflex would have him have his arms and legs up as he's falling, almost cupped in a C. But if he wasn't able to do that, we would have an abnormal finding. So we did the Moro test. So moving on to the extremities, I'm doing a general just assessment of them, making sure the color is correct, making sure that all of his, counting all the fingers, making sure that they're all there, that there's not an extra digit, making sure that the color is nice, there's not bluing of the fingers, and same thing with the toes, counting them all, making sure that there's no extra one. So from here, checking, make sure the baby's temp feels normal, that he's not cold, that he's not overly hot, which is everything is normal here. So from here, I'm gonna elicit 2 more of the reflexes, and I'm also checking before I even do this to make sure that he's in a flexed position. This is part of the general assessment that I would have done at the beginning of the exam, but also here, making sure that he's kind of flexed, he's not flaccid, not laying out. So we're checking it, everything is good. So now I'm gonna go into my next reflex, which is gonna be the palmar grasp, which is gonna be me putting my finger at the base of his fingers, and he should be able to grasp my finger just like that. And if he doesn't, we have a problem. So he does it both sides, so yes, it is intact. And then we move on to the foot. Do the same thing. It's gonna be the plantar grasp this time, which is gonna be our 5th reflex that we're testing. And then I'm gonna put my finger at the base of the toes. He should be curling the toes around the finger, which he does correctly. And that would be, while we're also down here, we're gonna do one more thing. We're gonna check the femoral pulse, because his pulses aren't the best right now because of all of his body mass that he has. The femoral pulse is the best one to test. We're testing down here, and everything came back normal. Okay, so from here we're moving on to we would check the genital urinary area. I would ask the mother, has he had any problems with defecating, with urination? Everything is okay?
No.
There's no diaper rash? There's been no problems down there?
No.
Okay. So, as she says that, I'm going to be checking as well. Whether this is a boy, I'm looking for extension of the distended testicles. They shouldn't be up anymore. We should be looking at them down. If it was a female, we're looking for any abnormal signs with the vagina. Same thing goes for both. We're looking for bleeding, lesions, bumps, bruises, just anything abnormal that we wouldn't suspect. And then once we have that checked, we're going to move on to the back. So we have the infant on the back. We're looking for any spinal deformities, making sure that the spine is in line and then it's not curved to one side or the other. I'm also looking for any lumps, bumps, bruising here as well, making sure that there isn't. We could have Mongolian spots, so I'm asking about that. I don't see anything here. The spine is midline and intact, so that'd be good. I'm also looking for skin breakdown. I don't see any skin breakdown here as well, so it seems okay. And then I would check the anal area as well, making sure for no rectal prolapse, there's no bleeding coming from there, there's no lumps, bumps, bruises, and everything's all right. So, put him back down. Do you have any questions for me?
No.
Okay, and that would conclude my physical assessment.